Well, the first thing that I think would be most important for men to know would be what I'll call the vital statistics of their own cancer. So the fundamentals that would be worthwhile knowing would be what their PSA blood test result was. That's important because it tells us often something about the cancer, how aggressive it is and how much of it there is. And that is helpful in determining to us, anyway, as physicians, what may be the most appropriate way of managing it. And so it's an important thing to know. Another thing that's important to know in the vital statistics is stage. So broadly that would be, is there any reason to think it has spread or not? And also within the prostate, is there anything to feel in the prostate gland when the doctor does a digital rectal examination? And if so, how much? And if there is something there, is it confined to the prostate or not? The third thing that is worth knowing in the vital statistics is the grade of the cancer, and that is described in terms of something called the Gleason score. And that number, which more correctly is given as 2 separate numbers out of 5, and often for short given as a total number out of 10, again is an important thing we think about and is therefore important for you to know as well. And when we have those 3 bits of information, then we're able to group cancers, so the smallest ones, low risk, the medium-sized ones, intermediate risk, and then the more aggressive, bigger ones, high risk. And so at the end of the day, I guess once you've learned the 3 basic things I just mentioned, you, along with us, will be able to learn what risk group you are in, low risk, intermediate risk, and high risk. And that'll help you make sense of the reading you're doing and the advice you're getting in terms of what management approaches may be appropriate. So once you have the vital statistics, including the risk group that you're in, the other things that are important to know are, number 1, does my cancer need treatment at all? Now that sounds like a very strange question to ask, but many cancers that we see are very small and non-aggressive and may not grow in a given person's lifetime. The other piece that's important for some men, not all, but some men, is what their life expectancy is, which will also influence whether we think treatment is required. So if somebody's going to live a long time, we might be feeling stronger about the idea of treating them sooner rather than later versus if they're not going to live a long time. And naturally, life expectancy is driven by age, and it's driven by other illnesses the man may have. So then, in summary, the second thing to know would be, does my cancer need treatment in the opinion of the people that I'm seeing? The third thing to know is, generally speaking, based on all the things I've just said, so the risk group and whether you need treatment at all or not, if you need treatment, what is the menu of treatments that would most reasonably be considered? Because there are some situations in which, for example, we might not favor surgery, or in which we might not favor one or other form of radiation therapy for some reason. So that would be the third thing, generally speaking. The fourth thing to become aware of is, for any treatment that is on that menu, what are the side effects of that treatment? Because basically, certain side effects will assume greater importance in some men's minds than others. For example, an impact on sexual functioning for one man might not matter, and for another man might be terribly, terribly important. So you want to know what the risks are for that, if that particular issue is important. Similarly, you want to know about the impact that a given treatment on your menu might have on other things like bladder function and bowel function. So these are bits of information that you want to have in your mind based on that menu of treatments on offer. And I guess the last thing, which is maybe the most important also, is how optimistic can you be about the future? So you want to get a handle on that. So what are the cure rates? How long might I live? All of these sorts of things. And of course, doctors can never answer that literally exactly for your particular case, but they can give you averages. So these are all things that are important to know and to learn as you move through decision making.